from the great state of Virginia. Bobby Scott, would you please share with us your own views and how this is going to affect the general welfare of the American people?
Thank you, and I appreciate your hard work, and thank you for organizing this special order so we can discuss the problems with repealing health care. You've gone all through the need for health care during your life and how the bill provides assistance for those with pre-existing conditions, limits insurance company abuses like what's called rescission, when you paid your premiums all these years and then finally get sick and they want to cancel your policy right when you need it. Lifetime and annual limits on benefits where they pay a certain amount, and once they get to that, you can be in the middle of a treatment and they're not going to pay another dime for the rest of your life, or at least for the rest of that year. There are many people with chronic diseases who hit up upon these limits very frequently. You've talked about young people on their parents' policies who are working, finally get a job, doesn't cover benefits up to 26 years old. They can stay on their parents' policies. Talked about prevention, the importance of prevention. A lot of people, because of co-payments and deductibles, can't afford the annual checkup. This bill provides for annual checkups without co-payments and deductibles. And for those senior citizens in the donut hole, where they get no benefits, have to, insult to injury, have to continue paying their premiums and get no benefit, we have assistance for them. It is outrageous that they would elect to try to repeal this. No hearings, no nothing, just put a label on it, call it Obamacare, and then expect people to go along with the repeal. You just can't label things and expect people by virtue of the label to take action. They call it government-run health care. No, government-run health care was a single-payer plan. That was defeated. The option of a public option would have been nice. It would have been nice to have given people talk about choice. Well, in the plan that's on the books today, they have the choice of all plans that anybody wants to sell insurance in their state. They have a choice of all of them. It would be nice to have an additional choice, a choice of a public option where you have the choice of a policy that is not run by a for-profit corporation with a financial interest in denying you coverage or canceling your policy. It'd be nice to have that option. You don't have to pick it, but it's just nice to have that option. One of the things that we want to make sure is that we have as many options as possible, including a public option if we can ever get there. But when they talk about repeal and replace, there's no replace tomorrow in the rule that they're suggesting. They just want to repeal. We want to know what they're going to replace it with, what they're going to leave out. Are they going to leave out the part where people with pre-existing conditions can get covered? They're going to say, no, you can't get covered. The insurance company gets to decide who has the privilege of health insurance company. They're going to tell young people under 26 to get off their parents' policies. They're going to tell those in the donut hole to get back in the donut hole where they belong. They're going to talk about those that can't afford prevention to get prevention. They're going to tell those who are going to run out of coverage because of the limits that, no, you just, what's good, that's enough, you've had enough, you can't get any more coverage. What are they going to tell all of these people? We need to make sure that we keep this policy, all of these provisions intact. I have no idea what they want to replace it with, but I think if they went step by step and the people looked at the provisions in the bill, they would elect to keep everything that's in the bill today. Now, there's some things that people don't like. When you have a good plan, you have to pay for it. And unfortunately, there are taxes in it because we're fiscally responsible. We're under, when we passed it, we were under pay-go. Now, they've repealed a lot of that so that they can go trillions of dollars in the ditch without paying for it. We paid for it. And in fact, CBO originally said that the first 10 years of the program would save the budget deficit, would reduce the deficit by $140 billion. Now the estimate is $200 and some billion in the next 10 years. So it is fiscally responsible. There are things we can do better together than everybody out for their own, and we need to oppose the repeal of this health care to make sure that people have the protections and the patient's bill of rights that they have under this legislation.
I thank you very much. You've raised about